The short version of my personal struggles with mental health started in 8th grade. I was diagnosed with generalized anxiety, and then sophomore year I was diagnosed with depression. Sophomore year things were going well, but that's because I kept my mental health struggles hidden from my peers. And then junior year that culminated after months of struggling with an attempt to take my own life. After that, I talked to my parents and got help, and then decided I didn't want that to happen to any other kid. I didn't want any other kids in my school or in Wisconsin or anywhere to feel like they had no choice but to take their own life. So spring of that year, I decided to organize a seminar at Sun Prairie High School under the name called Still Human. After our first seminar in the fall of 2014, we decided that we didn't want it to be a one-time thing, that we wanted to continue our message. So Still Human is currently a corporation seeking its nonprofit status. Our seminars focus on the 3 aspects of mental health education, removing the stigma placed on mental illness and suicide prevention.
7% of our male population has a serious mental health need, and approximately, I believe it's 12% of our female population has a serious mental health need. So if you deal with the mental health issues, you're making institutions safer, you're making the programs more effective because they're able to absorb the program, and you eliminate, well, you don't eliminate, but you reduce, minimize the use of restrictive housing, restraints, the use of OC to reduce, to quell disturbance, whatever that, as minor as that may be. The fact of the matter is by dealing with the issue that predominates possibly some of the causes and effects, you're making your institution safer and much more effective.
We have found in Wisconsin, because we have collected ACE data in Wisconsin, along with about 20 other states, we've really moved that needle forward by saying it's not just California and those 17,000 people. This is a national concern, and it's happening in every state. But in Wisconsin, we did something unique. We added elements that would point to resilience factors. So not everyone who experiences early adversity has these outcomes. So what are those things that are changing their destiny? And what they found are statistically significant protected factors are, they say that as kids, they had a parent or another person who they could discuss things that matter to them, and they can talk about their feelings. Okay, so that doesn't have to mean going to a therapist, right? I mean, and this is where I think we can figure out how does the community actually engage in this to build resilience so that the destiny of increased ACEs equals increased health problems and social issues.
Reimbursement for behavioral health care was 20% less than primary care, and primary care is barely adequate. And it was even using many of the same codes for that billing. And so we still have a major lack of parity across our country. And until that gets addressed, I don't think it's going to be very easy for us. It'll be an uphill battle for us to address access and to be able to provide the services that we need to provide across the community.
One of the biggest challenges is stigma in the African American community around mental health. And just the word mental health kind of draws concern because of how African Americans view, and through our spiritual context and spiritual traditions, we may tend to look at it as a spiritual challenge that we're going through versus a mental health challenge, which is why understanding cultural competence and the uniqueness of how culture plays a part in how we talk about mental health and how we talk about service delivery and effective ways to connect to folks who are in need of mental health services. Lots of successful models tie treatment to faith-based models, to spirituality, to cultural pieces, and through places that are really deep and important in our cultural landscape, like barbershops and hair salons, collective places where we go and have relationships of trust, where we can then engage in those types of conversations that open the gateway to make people more comfortable to think about mental health.